Hi, my name is Mariah Daly, and today I'll be playing the physician.
Hi, I'm Janelle Duncan, and I'll be playing the patient.
So, my patient here name is Miss Susie Joe, and she is a 45-year-old woman who is at risk for developing a DVT after her knee surgery.
What is a DVT?
A DVT is when a blood clot or thrombus forms in the deep veins in the arm or the legs.
I know what a blood clot is. It's reduced blood flow in the veins. That means the cells clump together, right?
That's exactly correct. Miss Susie Joe here did not follow my orders and remained in bed after her surgery. My orders were to be mobile and walk around her room. She decided to remain immobile, which increases her risk for developing a DVT.
Yeah, my nurse came over last night and we noticed that my legs were swollen, warm, and I was in so much pain.
So some of the other manifestations of a DVT include warmth, redness of the area, and tenderness. The nurse immediately calls me to have the imaging test completed. The imaging test used to diagnose a DVT is called a duplex sonography, which is the test used to look at sound waves and the flow of blood in the veins. It detects the blood clots in the deep veins. So, after the test, I decided to diagnose Miss Susie Joe as having deep vein thrombosis.
So, what does this mean? My leg is going to fall off? What's my plan of treatment?
So, you will be taking anticoagulants.
Oh, I know what anticoagulants are. They work to prevent new clots from forming, right?
That's correct. So, there are 3 anticoagulants used to help with the DVT. So, we have Lovanex, which is typically injected under the skin, Eliquis, which can be given in tablet, and Coumadin, which can be given IV in oral tablet. I note that you are able to take medication by mouth, so there will be no need for a IV injection. I decide to prescribe Miss Susie Joe here Coumadin and explain to her that she must undergo several blood tests weekly and that she will be monitored while taking this medication. Warfarin is contraindicated in those who are allergic to it, those who have hematology disorders like anemia, diabetes mellitus, hepatic and renal impairment, atrial fibrillation, any history of alcoholism, and any history of falling episodes, which will lead to head trauma, smoking, and any history of peptic ulcers.
And I'm looking at this pamphlet about Coumadin, and it says here that aspirin and NSAIDs are contraindicated as well.
Yes, that's correct. Aspirin and NSAIDs will increase your likelihood of bleeding. So for Coumadin, also known as warfarin, the overdose, if you have an overdose, we will give you the vitamin K, which is the antidote.
I love dark green leafy vegetables.
Well, a diet high in vitamin K should also be avoided because it will decrease the effectiveness of this medication.
My friend was on this medication and she said she had blood in her vomit.
Well, if you have any severe bleeding, you must stop taking this medication, contact me, your physician, and if you need to, go to the nearest hospital.
So what are the other side effects?
So, some of the side effects of this medication include severe hemorrhage, which we talked about, any blood in your urine or your stool, severe headache, dizziness, weakness, vision changes, and easy bruising.
Okay. So how am I going to take this medication? By mouth, injection?
Well, Coumadin will be taken by mouth at the same time every day with all of your meals. I will start you out at an initial dose of 5 milligrams orally once a day. Do not double up on any dosages or if you miss a dosage. So the dosage may increase once I see how effective this medication is, and your INR will be at 2.5.
How long will I be on this Coumadin?
So you'll be on Coumadin for about 3 to 6 months depending on how effective this medication is.
Are there any other major complications that I need to look out for since I didn't follow your initial instructions?
Yes. There is one complication with a DVT, but don't be alarmed. With a DVT, you are at risk for developing pulmonary embolism, which is a blockage of one of the pulmonary arteries in the lung, and it travels in the bloodstream. Some of the signs and symptoms of a pulmonary embolism includes chest pain, shortness of breath, and irregular heart rate.
Okay, good to know. Thank you, doctor.
No problem.